Hello, I'm Dr. Timothy Doyle from Delaware Eye Care Center. I'm going to tell you a little bit about cataracts and how we can get them out. On this diagram here, this is the eye from the side. This is the front part of the eye, that's the cornea. Behind the cornea is the color part of the eye called the iris, and behind the iris is a lens. A cataract is a clouding of the lens, and that clouding makes it harder to see through. So in order to get the cataract out to get you to see better, we make a tiny incision in the side of the eye. Typically does not require a stitch. Now the cataract is held in a bag, so when we go in, the first thing we do is make a hole in the top of that bag. We go in, break the cataract into pieces and remove it, so what you're left with is a clear empty bag with nothing inside. We go right back in and put a new lens in, and that's what helps you to see things better and more clear. Now this is the most common surgery in the world. It's the most successful. What do we worry about? Infection, swelling, inflammation, things typical with any procedure, and you're given drops to decrease those risks. This is done in a surgery center, not in a hospital. We do one eye at a time, usually 2 weeks apart. The surgery takes 10, maybe 15 minutes, and you're given anesthesia so you're comfortable, no pain or anxiety. Now, when we put the lenses in, there are different types of lenses, and they do different things. Most health insurances, Medicare, Medicaid, cover a standard lens, and this is a blown up version of that lens. And the lens that every insurance covers will help you to see things in general better further away. If you have astigmatism, which has to do with the shape of your eye, the standard lens will not correct for that. There are lenses that will correct for the astigmatism. Those will still only help you to see better further away and not up close. And then there are two other options that will help you to see better up close. This specific model lens that has these little rings in them, this is called the Panoptix lens. And these little rings help to elongate the focal point to help you to see up close, both for reading and at the computer. The distance vision and the near vision with this lens is very good. There are positives and negatives with any surgery and any lens that we put into the eye. The positives with this lens is the distance tends to be very good and the near tends to be very good. But sometimes people will see little halos around lights at night. It's not like glare from the cataracts, but they're faint little halo lines. Those tend to go away over time. There's a second type of lens called a Vivity lens, and that's not this lens, but instead of the lens being flat on top, there's a very small bubble in the center of the lens, and that bubble helps you to see things up close better also. The benefit of the Vivity lens is it doesn't have those rings, so you won't see those halos at night. The downside is the reading maybe is a little bit weaker than the Panoptix. I've done a lot of both of these types of lenses, and I've had patients be very happy with whatever they choose. And the surgical counselors will go over which lens would be better considering your circumstances. One of the other questions that people ask is, which lens is better? And the one thing to remember is that the material in the lenses, whether it's the standard lens, the Panoptix, the Vivity, or the astigmatism lenses, the material is essentially the same. So if you have to go with the standard lens, it's not any less of a material than the Panoptix or the Vivity. If you have any further questions, I'd be happy to answer them in the exam room.